The Bridge Clinic is an urgent care, transitional addiction clinic where we are meeting people where they are, meaning we're taking people at all stages of their addiction and recovery and helping them to engage in meaningful treatment and plug them into long-term addiction care.
The way I think about our clinic and how things changed, I see this as a response or as a reflection of how the science of addiction has changed, what we have learned about addiction has changed. So we have now ways to engage people in different ways that we didn't really engage maybe in the past, maybe 10 years ago.
And historically, people with addiction have been conditioned to keep their disorder secret because it's been so stigmatized and people have been blamed for this and it's been seen as a moral failing. And if they would, quote, just stop, everything would be fine. And that's where the education comes not only for the patients, but also their family members, for the public, for other treaters, that it is not in their control, and that's the hallmark of addiction.
This disease has to be approached like a chronic illness, just like diabetes or blood pressure or asthma, meaning there are different stages. People get better, they may not have a lot of symptoms for a while, or they may relapse. And regardless of the stage, we have to find ways to engage patients and provide treatment.
We have irrefutable evidence that this is a medical illness, and it's important to say when we use the term illness to follow that up with saying that this is something that's treatable.
We have treatments that work. We know how they are effective. They prevent relapse, they prevent cravings. And when people are asymptomatic, we continue to engage them and we continue to treat them so that they continue their stability and they continue their healing.
We have the ability to give people hope that they can get better, and I see them get better, and we work with them and they improve. And we understand, just like other chronic diseases that we treat in the primary care setting or in the hospital setting, that there will be relapses and remissions, and improvement over time is that those remissions will be longer and the relapses will be shorter and fewer over time. And with a good, trusting relationship with an evidence-based treatment model, people recover.